Welcome to another installment of Project Care's Facebook Live presentations. This month we will be discussing the importance of having a primary care provider. Please hold all questions to the end. Once you are enrolled in a plan through the state of Minnesota or your employer, it's time to pick a primary care provider. Why is having a primary care provider important? They're going to be the doctor that you see the most for treatment of your illnesses. They're someone that can continue to see you throughout your entire life and will provide preventative services during the course of your treatment. What is a primary care provider? A primary care physician is a type of doctor who can help prevent, diagnose, and treat a wide range of health conditions. A specialist is someone who is trained in how to treat a specific bodily system, such as a gastroenterologist is for your gut health, or a neurologist is for your brain. A primary care provider is trained to be able to treat multiple different illnesses and diseases with multiple different systems of the body. What does a primary care provider do? They can screen you for your health conditions. They will provide your physical and keep you up to date on immunizations. If you go to them, say with symptoms of like, for example, gut issues, they'll run tests to diagnose where the source of that issue is coming from. And they'll continue to take care of you once you are diagnosed and provide treatment. Who can be a primary care provider? It doesn't have to be someone who is certified as a doctor. It can be a nurse practitioner or physician's assistant, or somebody who is specialized in treating you during certain times of your life, such as infancy or when you're elderly. A question that we see frequently with our clients is, where should I go for treatment? So the first slide I have here is, when should I go to my primary care provider? Again, this is for your physical and preventative visits, immunizations, if you need a medication refill, anything along those lines. If you have a cold or flu, they can provide treatment for that as well. When should you be going to urgent care? These are for slightly elevated illnesses, such as the ones that are listed here. These are situations where you're not able to see your primary care provider immediately, but you are ill enough to still need some sort of treatment. And finally, when should you go to the emergency room? When you are needing to go to the emergency room, these should be life or death situations. A lot of the times this would be heart attack. If you get into a car accident, you'll need to check that you're not severely injured, anything to do with neurological symptoms, such as when you are exhibiting signs of a stroke. And why is it important for you to go to the right place? The first reason would be for time. If you go to the emergency room for a sore throat, you could be waiting for hours at a time. When you go to the emergency room, they're going to treat the patient who has the worst condition first. It's not a first come, first served basis. Along those lines would be follow-up care. If you go to the emergency room, they're not going to follow up with you to see if the medication they gave you for your sore throat is working. If you go to your primary care provider, that's something that they'll follow up with and schedule additional appointments to get you the correct medication. And lastly, the most important would be, or one of the most important would be cost. If you go to your primary care provider for your preventative visits, those usually are covered by your insurance at no cost. If you go to your primary care provider for other issues, such as a follow-up appointment, you might be facing, we'll estimate a $25 copay. If you go to urgent care, you would be looking at between a $50 and $100 copay for those services. And the emergency room, you would be looking at closer to $200. What should you consider when choosing a primary care provider? You can ask your friends and family and people in the community if you are looking for continuous treatment of a specific illness. Sometimes there's Facebook pages that you can look at within your community, and they'll provide recommendations. Another thing that you can do is go on to the clinic's website, and a lot of them will provide a mini biography of the providers that are available, and they will list some interests of those providers, such as if they're LGBTQ friendly and other information. If you are enrolled in a public program through the state of Minnesota, you'll receive an enrollment form in the mail after you're approved. You'll fill out the information for your primary care provider, and they will enroll you in the insurance that it would be considered in-network. In this circumstance, in-network means your insurance would be willing to pay for services or pay more for services. And why is primary care important? When you go to your primary care provider, they're able to better manage your illnesses. Because this is someone that you're seeing frequently, you're more comfortable around them. If you go to the same person, you're not having to explain what your symptoms and situation are every single time you go to them. If you go to a new person every time, you're going to need to provide your medical history and explain what has been done up to that point. And if it's something that your primary care provider isn't able to help you with, they'll refer you to a specialist who can better diagnose and treat your symptoms. And this is our team. Project Care is a team of certified navigators. We offer bilingual services in Somali, Spanish, Chinese, and Vietnamese. And if you are interested in more information, or if you need help with your current health insurance, you can give us a call and schedule an appointment. We offer in-person appointments at all of these locations as well. And do we have any questions? Okay, one question I see is what happens if I go to my primary care provider and another provider in the same day? How much would that cost? A lot of insurances, if you go to your primary care provider, you'll have, I'm just using this as an example, is your $25 copay. And if you go to another physician in the same day, it would more than likely be another $25 copay. Versus if you go to the emergency room, you're having to pay the $200 or so just to be seen. Okay. Any other questions? All right. Thanks everyone for tuning in, and follow up next week. We'll be having another presentation in, I believe it's Somali, but you can check our Facebook page for more information.